Well, at some point, even after the collection calls and the statements and everything, there still hasn't been payment. It's clear that if the patient still hasn't paid, there will have to be strong measures taken. What would you suggest the final warning letter say to the debtor?
Well, first of all, you asked that question properly. One final warning letter. I run into so many accounts that, again, their computer billing program will spit out collection letters. What does the second one say? I really mean it? Or maybe the third one says, I really, really mean it? The point is, collections is about a progression of severity. And after you've sent them a couple of statements, it's time for a warning letter that has impact, but yet you're only probably at 90 days past due, maybe even sooner than that. So you don't want to come across sounding like Genghis Khan. You want to be the patient's advocate. So we would suggest that you send out a warning letter that says something like, to protect the vast majority of our good clients from the high costs of the relatively few who don't pay on time, our accountant has changed our billing and follow-up procedures. As of such and such a date, all accounts that go beyond 90 days past due will be auto-transferred to a national collection agency for accounts receivable assistance. Please avoid this and contact me today. What we're trying to do, Kent, is we're trying to set up the practice, the office manager or the staff person, as the patient's advocate. They're trying to protect the patient from this national collection agency, which would be the next step in severity.
So in other words, we're on your side. We don't want to send, this to be sent to the mean national collection agencies. We want to handle it, and protect your good credit and everything else before it gets to that point where you guys come off as being the good guys.
Absolutely, absolutely. And it's much easier for your staff to talk to a patient who calls in wanting to make an arrangement rather than your staff having to try to call out and then be the hard guy, the collector, and demanding payment.
One way I would think to avoid bad debt is to implement a policy that the total amount owed is due immediately. Is there a way the office staff can tactfully tell patients that payment is expected at the time of service?
Well, Kent, as I said, I've been in this industry for a long time, and I haven't created very much, but I've seen a lot. And one of the best practices that I've seen was almost every practice has a patient sign-in sheet when they first arrive at the office.
Yes.
What I'd suggest is, rather than just having the column for the name and the time of the appointment, put an extra column in there that says preferred method of payment today, and then offer the options, credit card, cash, check. Now, what you're doing is subliminally telling that patient that you're expecting payment today. There's a spot for them to write down how they plan to pay their portion today. And that's something that you want to get into their mind as soon as they arrive at the office.
Sure. That's a great idea. And so in those kind of situations, if they come to you and say, look, I didn't bring my credit card or a checkbook or anything, can I pay next week? I mean, you still go ahead and let them, but you would just cut down the number of patient counts that are out there. You may still have some, but you would cut down drastically, I would think, with that procedure.
Absolutely.